that again. All right, you're back on.
Should I repeat it? Or? I had a lot of pain a couple hours after, but nothing that the automatic pain pump. Jason, I just was pressing it every 2 seconds. So they gave me the cocktail, and I didn't know anything. And then about 2 hours after, I was up and walking, and I guess I walked to the end of the hall and fell asleep, and then got up and walked again. And
You fall asleep in the hall?
well, I would get to the edge of the chair and fall asleep. It was strong. It was strong, but
Strong pain.
then after that, just the next couple of days were just a little bit of feeling the gas. I called you, and that was it. I felt terrific.
Good. Questions?
I asked about the hormones. Could I these are little questions, but could I be eating too many saltines and pretzels?
The potential exists for too much salt intake, and that has the name of hypernatremia. We have never seen hypernatremia from excess saltine crackers, and that's why we use them, because they're a pretty low risk. On the other hand, some people ask, oh, Dr. Rutledge, can I take salt tablets? And we don't recommend them because that does have the potential to put so much salt in that there's risk. But we've never seen anyone get in trouble with excess chicken noodle soup or saltine crackers, so you're okay.
And stretching, I was reading about.
There's no such thing for us and stretching. Stretching is a story that goes along with the other kinds of surgery. Now, not to be critical of other kinds of surgery, but there's a long history of stomach stapling and Roux-en-Y gastric bypass patients failing. That is, a year or two later, they start gaining their weight back. And my email is actually filled every day with the inbox has got 2 or 3 people every day who've had stomach stapling or gastric bypass of the Roux-en-Y type, and they've gained their weight back. Okay, and they say, I want to have the MGB with you. And we see that, and imagine you're the doctor who's giving those patients their surgery. When they see them back, the doctor often says to them, oh, you failed. You stretched out your pouch. So that means it's not the surgery's fault, it's the patient's fault. Okay? And that makes the surgeon, I'm sure, feel better because it's hard to give somebody a treatment that fails. In our situation with the MGB, I take credit for the success. So we have almost 4,000 people that have succeeded after the surgery, and I take credit for that. But I also take responsibility for the failure. So we don't think you stretch it out. We think there are some patients where I haven't bypassed enough, and the surgery doesn't cause all the weight loss, but we don't blame the patient. We don't think we see stretching. We think instead, at the primary surgery, I just didn't bypass enough. So stretching is not something we worry about. We say put that out of your mind. And the data on 10 years of our surgery suggests that it's very reliable, that we have very little weight regain over time. We can see some in some patients, but it's a very reliable surgery. It's very durable, and so I wouldn't worry about stomach stretching, so it's a good question.
Okay. Hard candy in the hospital you could have for dry mouth after?
Sure.
Should be fine? Okay. A couple of other little questions.
Sure.
I was reading garlic and red pepper. Any of those seasonings you said are good for the gut? Still?
Terrific question. One of the biggest fears of the MGB is something called an ulcer or gastritis. So we all know you've seen advertisements for medicines to treat ulcers, antacids and things like that. We also now know there's a lot of ways to help protect you from getting an ulcer in the first place. So let me say that again. The biggest fear, the biggest complication that we see after the MGB is ulcers or gastritis. And we also know a lot of ways to help protect against that. We're learning more. So, green tea, yogurt, hot pepper, cayenne pepper, garlic, olive oil, citrus. Healthy, fresh foods seem to help protect against ulcers. Some things cause ulcers, like cigarette smoke, cigarettes, alcohol, aspirin, and so in our manual we have some guidelines like that. We say, eat the healthy things in general, and so garlic and spices and all those things are fine, and avoid things that cause ulcers, like alcohol and cigarettes and aspirin, soda pop and coffee and things like that.
And start it right away. Okay. Afterwards, the creatine, the whey, some of it comes in tablets, it's okay?
Absolutely, the tablets are fine. There's some creatine that is mixed with a big dose of sugar, because sugar has been shown in weightlifters to help build more muscle. And so when you're buying your creatine, I personally am not so driven that you have to build muscle that I would take the creatine that has a bunch of sugar in it. So just look on the back of the box or the tablets that you're getting, see if they have a lot of sugar in them. I don't think that's necessary.
Okay, but the Pepto comes in tablets. Those are
Pepto's
one dose
fine in
to-
tablets,
okay.
right.
That's it. Thank you.
Good. Take your staples out.